Every month, the agency takes out an amount per person per month, and it is sent to the facility under which you are empaneled for your care. So whether you walk into that facility or not, that fixed amount is paid. So for a family of 6, for instance, we will pay that amount per each member of that family, and it goes to that facility upfront. We pay within the first week of every month. Since Lashma started, I make bold to say we have never defaulted on payment. That money will go like clockwork to that facility for your care, whether you come in or you don't come in. Ilera Eko, Ilera Eko, if you're working in a company, for instance, your HR would have sent us the list of names of people to be onboarded onto the scheme, and you pay your premium. It's called a premium, which is in our case 15,000 for an individual for a year. Let's just use the individuals. Or family is 55,000 for a family of 4. So you will pay your premium. We have flexibility to some extent, but not really for corporate Lagos. So you pay your premium upfront. Now, once that money hits LACHEF, which is the health fund that we administer, every month the agency takes out an amount per person per month, and it is sent to the facility under which you are empaneled for your care. So whether you walk into that facility or not, that fixed amount is paid. So for a family of 6, for instance, we will pay that amount per each member of that family, and it goes to that facility upfront. We pay within the first week of every month. Since Lashma started, I make bold to say we have never defaulted on payment. That money will go like clockwork to that facility for your care, whether you come in or you don't come in. That is what we call capitation. Now, there are some services that are not covered under capitation. For instance, the cesarean section that we talked about. When your wife has gone for the cesarean section, because it is covered, the hospital will now make a claim, send us a claim after the delivery, right, which they should have uploaded onto the system. We give them a number of days to be able to upload that to the system, and within 60 days, because the 60 days is the lag, you send us, and then we now send you back the money, and you get your claim. The hospital is now paid for that service, so they're not expected to collect an additional dime from the patients, because the agency is going to pay on that person's behalf.
Okay, so I want so in terms of emergency cases now, you know, does this policy allow for emergency cases? Maybe the person is brought in and cannot identify himself, that he has a health insurance scheme or something. So is there room for that person to receive adequate health care even without being able to identify himself?
So the beauty of IT is that you can pull out someone's information from the system, as long as you know the person's name and the names that they used to register themselves. For instance, the system can give you your policy ID on inquiry. This is the policy ID of this person that has come in, and yes, you'll be able to access care as an emergency care patient.
Okay.
Okay, so far, I know you have had so many successful stories. What has been the challenges facing the agency?
The first one is what we talked about in terms of the mindset of people and the culture, and the fact that it was not compulsory. Anywhere in the world where there has been success at UHC, it is because there is compulsion. The government makes it a compulsory thing for people to sign on to. So that was an issue, that you could decide to opt in or opt out, right? Which the executive is going to try and clear. The other thing is the economy. So even with when we started and where we are now in terms of the prevailing economy, we know that it's not easy. So for people that ordinarily do not prioritize their health, right? Very important things like stomach infrastructure, for instance, are prioritized over health, which is normal, right? trying to get them to now understand when there is serious cost constraints is a serious challenge which continues to be there, and that's why we bring in the flexible payment mechanism, which we call pay small. You can pay monthly, you can pay quarterly, you can pay half yearly rather than having to pay upfront. And then we also have on the ECOSHA arm, which is Eco Social Health Alliance, the 1% of the equity fund that Mr. Governor has provided to the agency, which is now like a first line charge. That fund is used to cover people that cannot pay for themselves, the vulnerable in the society. We also have people that work with us in terms of supporting maybe particular subsegments of the population. So we have development partners also sponsoring some lives. We have well-meaning members of society, NGOs, politicians, etc. A lot of people come together to support what we're doing, and yes, we have that opportunity to be able to cover those that are genuinely struggling.
Hand in hand, Lagos hand.